RPB is pleased to present a Q&A on Stargardt disease with Mark Pennesi, MD, PhD, Farvo. Dr. Pennesi is the Director of Ophthalmic Genetics at the Retina Foundation. He is also Professor of Ophthalmology at Oregon Health and Science University. He is an expert at Stargardt disease and also an RPB grantee. We're pleased to have him join us today. What is Stargardt disease? Is there a specific gene or genes that causes it?
Stargardt disease is a genetic eye disease, and when we talk about Stargardt's, we're referring to people who have mutations in a gene called ABCA4. And really, a better name for the disease is ABCA4 related retinopathy because it really emphasizes the gene. There are a few other genes that can give you a Stargardt-like picture, but are caused by other genes. And so we try to differentiate those. But patients who have Stargardt's typically have two mutations in the ABCA4 gene where they have inherited one copy of the mutant gene from mom and one copy of the mutant gene from dad.
Can I get Stargardt disease even if my parents do not have it or I'm not aware that they have it?
Many times there is not a family history because if you just have one copy of the gene, you do not get the disease. And the frequency of being a carrier for Stargardt's is rather high. It's about a 1 in 50 chance. So many times there is not a family history, but most often each parent is a carrier for a single mutation. Now, there are some very rare cases where you might have a parent who doesn't have a mutation in ABCA4, and there's what we call a novel mutation that occurs during embryogenesis, but that is actually quite rare.
What does genetic testing for Stargardt disease do, and how do I go about getting it?
We really strongly encourage everyone to get genetic testing these days. First and foremost, to confirm the diagnosis. We can make a clinical diagnosis of Stargardt's, but there are other genes that can look very similar to Stargardt's, and they have different pathologies and even different forms of inheritance. So even if we're pretty sure that this is Stargardt's, we do want to confirm that with genetic testing. The good news is genetic testing's gotten pretty easy. So most of the time we can do the testing just by getting a saliva sample, and then we send that off to the lab, and it usually takes 1 or 2 months to get the results back. And a good proportion of the time, we do get a positive result. But it's always important to remember that genetic testing is a little bit like fishing. You don't always catch a fish. That doesn't mean there's not a fish in the lake. Just sometimes we don't find the mutation. And sometimes in about 20 or 30% of patients, we may find a single mutation in the ABCA4 gene, but we don't find a second mutation. And often that doesn't mean that you don't have Stargardt's. It just means that the technology is such that we fail to find that second mutation. And many times, years later, we will find a second mutation as we kind of improve our ability to interpret the genetic results. And there may be some, cases where, there might be something else going on. So if we don't find a second mutation, we're also going to go back and take a second look and make sure there's not another gene that might be the culprit.
I've been diagnosed with Stargardt disease. What's the best way to protect my eyes going forward?
Well, we don't have a cure for Stargardt's. And, I think one of the most important things is to really get a good diagnosis and then to consider being in a clinical trial, because we have a number of clinical trials now for Stargardt's. But there are a few things that we do recommend people to do. One important thing is to be cautious with vitamin A intake, because the ABCA4 gene is responsible for vitamin A metabolism in the retina. And vitamin A is an important component of the visual cycle. but it is also the element that gets broken down into the toxic metabolites. And so if you have a lot of vitamin A, and in animal models, if we give the animals high doses of vitamin A, it can actually make the degeneration go faster, or there to be more accumulation of these toxic products. And if you look at, just things like, multivitamins, sometimes they're loaded up with really high doses of vitamin A. And so we don't want people taking that, because theoretically that could make the vision worse. Now, that doesn't mean that you need to avoid all vitamin A, and that might not be a good idea, either, because you do need some vitamin A for your regular metabolism. So, we say that it's okay to get the daily recommended allowance of vitamin A, but to be very cautious not to take these supplements with high levels of vitamin A. The other recommendation we make is to get lots of antioxidants and omega-3 fatty acids. The evidence for that is not, incredibly strong, but we do think there may be some, benefit, and it's probably good for, the rest of your body as well. And then finally, wearing sunglasses when you're outside, is a good idea, because animal models, once again, we've shown that if you put animal models of Stargardts in high levels of light, it does tend to make the degeneration worse. And so over the course of a lifetime, it's a good idea to, wear a hat, wear sunglasses. That doesn't mean you shouldn't go out to the beach, one day. That's fine. We're not worried about that. We're not worried about, looking at a computer screen, but just to be a little cautious.
How fast will my vision deteriorate?
A patient is really their own best measuring stick. And, we can even see sometimes in siblings who have the same mutation, there might be different rates of degeneration. So if, we follow somebody over, maybe a year and a half to 2 years, and get a couple of different time points, that really does kind of let us look at what the change is. And that actually is probably the most accurate way to kind of assess what might happen in the future, rather than looking at a group average, of 100 people, where you're going to have people with different rates of degeneration all sort of combined together. And so, what I really encourage people to do is, to sort of regularly follow up with a specialist. And usually, after I've seen somebody maybe 3 times, I can really give them a sense of, what is going to happen over the next 5 or 10 years.
Are there any existing or emerging treatment options in the US or outside of the US?
Yes, and that's what's very exciting right now. At our center at the Retina Foundation, we actually have 6 different trials going on for Stargardt's, and there are even a few more that we don't have, and many more sort of coming in the pipeline. So, and even if you go back 5 years ago, there was maybe 1 or 2 trials going on. So the treatment field has really exploded in the last couple of years, which is, very exciting for patients. Now, I always caution people that, 90% of all drugs fail. And so, some of these experimental therapies aren't going to work, but, hopefully some of them will. And, we do have a lot of preliminary data from a few that look very exciting. So, I think that we're getting very close to at least having something to slow down the progression. And, hopefully we will have things like gene therapy to maybe halt the progression, and then in the future, things like stem cells and optogenetics to perhaps even bring back vision.
What are the clinical trials that are happening right now, and how can I find out about them?
I think there are a couple of different ways. One way is to go and visit inherited retinal degeneration specialists and just ask them about, trials and what trials might be available. The second way is to go on clinicaltrials.gov and just search for Stargardt's, and that will show you any trials that might be recruiting, in the nation, and sometimes even internationally.
What kind of support and community organizations exist for people with Stargardt disease?
One of the really great things about the internet is that it has allowed patients with rare diseases to come together and find each other. And a good starting point, I think, for many patients is Foundation Fighting Blindness. They are often a go-to spot for a lot of patients with these genetic eye diseases. But even beyond that, there are Facebook groups and Instagram groups, different patient organizations, and those are not too hard to find if you're interested in them.
Will I be able to drive?
With driving, it is a little bit more complicated in the sense that every state has its own, laws and regulations. But I will say that may become a moot issue in the future with self-driving cars. I actually have a Tesla that has the full self-driving, and it does pretty well. And I think that could be a game changer for patients, with low vision. Now, we're going to need some changes to the laws, to allow that to happen. But, I think that loss of mobility is one of the biggest fears people have. And, maybe technology is going to solve that for us.
Are there technologies that can allow me to live my life independently?
Even just in terms of kind of augmented reality, many of my patients are getting like the meta glasses, and you can just hold up a menu and have it read out what is in front of you, which I think is incredibly cool. And just knowing how technology goes, it's only going to get better. So, in terms of the low vision aids and such, I think we're going to have, different glasses where you can just sort of point them in a direction, and it'll describe to you, what is going on, or, help you navigate, or even enhance or change, what you're seeing to optimize it for your specific vision.
Thank you for joining us for this Q&A. Visit www.rpbusa.org for more information on eye diseases and conditions anytime.